Check this out. This patient was referred to me for endodontic treatment of tooth number 30. He was a wrestler. He's 18 years old now, and he said when he was younger, he used to wrestle, and I'm guessing trauma caused this. All right, you can see periapical relucency here and here. He said he had a swelling on his gum, and it popped on its own a few days ago, and I could see the remnant of it. But you can see the periapical relucency here and here, and look at all of that root resorption on the distal as well. So I immediately, when I look at a tooth like this, I can envision what it will look like after I'm done with it. And in this case, I can see MTA here, of course, after all the cleaning, shaping, irrigation with a full strength sodium hypochlorite and activation, all that stuff. But I can already see the end result in my head. This case was presented yesterday, and I'm sorry I didn't say this in that video, and some of you complained. So I presented this case yesterday and we talked about it. If you haven't seen the video, go ahead and watch that video about the representation of this case and what's going on with it. So yesterday we went ahead and started and completed the endodontic treatment in one appointment, and take a look. This tooth had 5 canals: mesiobuccal, middle mesial, mesiolingual, distobuccal, and distolingual, as you can see. I had to place MTA plugs in all 5 canals, and you can imagine how challenging that was, placing MTA plugs in 5 canals. And that's what we did. MTA plug here, MTA here, complete MTA in the middle mesial, MTA plug here, MTA, and then went ahead and placed my gutta percha and sealer over it, and temporized the tooth and referred the patient back to his dentist for the permanent restoration. So we scheduled the patient to come back in a few months for a post-op. Hopefully he'll show up. Usually they don't show up because they have no symptoms. They don't show up usually. Hopefully this patient shows up, and I can present the post-op with x-rays as well. But as you can see, everything went beautifully. 5 canals, as you can see, 3 mesials, 2 distals, and we had to place an MTA plug. Everything went great, as you can see. Hopefully these lesions will heal over time. We'll see.